Hi, What the Health Tech listeners. I'm your host this week, Paul Johnson, and this is the podcast where we look at some of the trending topics, challenges, best practices within health and social care. I'm joined this week by Owain Rees-Hughes, who's an ENT surgeon within the NHS, and Owain has first-hand experience of some of the challenges, frustrations around some of the clunky and siloed systems. And as a result of that, went on to solve that problem directly by creating his own solution. So Owain founded Synapsys to help support and fix some of those challenges. Thanks for joining this week, Owain.
Thank you very much, Paul. Very pleasure to be with you.
Fantastic. I've got a few questions for you, which I've kind of compiled ahead of this. But for me personally, this resonates with me heavily because I'm kind of in a similar position that seeing some of the challenges faces across health and social care. Myself and Lee Williams, co-founder here at Radar Healthcare, we did the same thing in terms of trying to find a solution through technology and software to address some of those challenges and problems. So yeah, you're in good company and definitely resonates with me. And it's really great to see that having a surgeon and somebody's on the front line that's built a solution that's been widely adopted. So yeah, please tell us a little bit about Synapsys.
Yeah, well, as you say, Synapsys came really from the experience I had of seeing patients in the hospital who'd often waited a long time to see in my case an ENT surgeon, and really, what I found was for many of those patients, either they didn't often need to come and see us face to face, or they were sometimes referred to the wrong speciality, or they were referred at a time where there were a few more investigations that could have been done before they came. And the result of that for the patient is that one, they were waiting a long time before they could start treatment often. Two, they'd be very frustrated and anxious. That often they'd expect that they were going to have an operation, and when I was explaining to them that probably they didn't need an operation, sometimes that would come as a surprise, sometimes disappointment. But also, it caused a lot of problems for us in the hospital. It meant that our waiting lists were longer. We had less capacity to see, the very urgent patients who really needed to see us, including, those on the cancer waiting list. And also from talking to colleagues and people who were referring to us in primary care, often they felt very isolated. They had, at that time, they had very little option but to refer the patient or to send them to A&E, or to send them for an outpatient appointment, where often they would know that probably wasn't always what was best for the patient, that they would much rather just get a bit of advice, talk to a specialist, and implement the right treatment there and then. And really that's what we built Synapsys to do, to give GPs, nurses, paramedics, optometrists, all kinds of clinicians who are seeing patients in the community, give them real-time access, with one click, access to advice from specialists, and that's what we built Synapsys to do. That was the vision, and we haven't deviated from that really. So it's the vision has stayed the same. We're just doing it now for many more patients and across many more parts of the NHS.
Brilliant, fantastic. So from a patient perspective, if I was logging onto Synapsys, is that at a patient level, so they almost have a choice and can navigate their own pathway, albeit it's obviously being directed by the software? Or is it predominantly used by the GPs and those that are going through that kind of triage process?
Yes, that's a great question. So Synapsys is used by clinicians. We have some interfaces with patients, but the primary users are clinicians. So as a patient, you would either be having a virtual consultation with your GP, or you'd be sitting in the room with the GP, and the GP will would talk to you about your problem, examine you, and they would be thinking in their mind, I'm going to send Paul to A&E because I think this is urgent. And rather than just send you and say, turn up at A&E and they'll deal with you there, what GPs are able to do now is, through Synapses, one click, they'll talk to the team who are going to be seeing you there anyway. So they talk through the problem and say, I've got Paul next to me. This is his problem. This is my examination findings. This is what I'm thinking. What do you think? And it sounds really simple, like a really basic thing, but the impact of that conversation is massive. So from the data that we have, we know that conversation changes what happens to the patient more than 8 times out of 10. So 30% of the time, just with that conversation, the patient can avoid going to the hospital at all. And we know that half the time, the patient may still go to the hospital, but they don't need to go to A&E. So the specialist would say, start this treatment now. They don't need to come in today, but we will see them, in our clinic next week, for example. And just something. It sounds such a small change, but that small change, when you deliver it across, a health economy across parts of the NHS, it has a massive impact on how the burden of work that the hospital has to deal with. So it really changes something that's emergency care, patient turning up to A&E, changes it from emergency care either to community care or to planned urgent care. So it has a real massive impact for the patient, but also for the whole system.
Yeah, no, I mean, the benefits seem obvious. One thing I was going to ask about the inspiration behind this, but I think you've kind of articulated that already. And I suppose there must be 2 elements to this. One is that the patient experience and outcome surely is improving here because I'm expediting and getting to the right treatment and the right pathway for me. And I suppose the other side is the experience from yourself and surgeons and clinicians, about almost avoiding that frustration from a patient. Have you seen that impact already, where you kind of say actually the flow through and the relevance and the pathway seems, more aligned to the patient needs now?
Yeah, absolutely. So clearly, patients don't want to go to hospital unless they need to, and avoiding that or turning up to the hospital when they're expected. When somebody knows their story, there's already a conversation happened through Synapses. That conversation is available for the team who's seeing them to review. There's already a plan in place, made between the GP and the specialist, even before the patient has left the GP practice. And that is a totally different experience for the patient versus turning up in A&E, having to be asked all the questions from scratch. Once the Synapses episode has happened, that episode of care for the patients is completely different because they're going into a department in the hospital that already know about them. There's already been a conversation with their GP, and the kinds of things that Synapses allows specialists in the hospital to do, for example, is to think about discharge planning. So, even if the patient is coming in to be admitted to the hospital, because they can talk to the GP, they can start to think, okay, what is the support going to be like when the patient leaves the hospital? So these are the types of things that can go into that plan that comes out of the conversation on Synapses. So it has a massive impact on the patient and benefits to their journey. How quickly treatment is initiated. If you think of something like stroke, the difference between somebody with a suspected stroke in the community being sent to A&E. If you compare that to what we're doing now with stroke units, which is having a conversation and saying, don't go to A&E, don't send the patient to A&E, send them to our stroke unit. We have a dedicated scanner, and they'll just be direct fast tracked through the scanner and initiate the appropriate treatment much quicker. So it has a massive impact. But you're absolutely right. The other side of it is the impact on the working lives of GPs and specialists. So if you think about it from a GP point of view, rather than having to navigate very complex health problems with the patient isolated, without the ability to get support from their colleagues in secondary care, with Synapsys they can just pick up the phone and have that conversation with their colleague there and then. So they feel much more supported, and they rate their experience really highly. So, we collect a lot of data about their experience of using Synapsys, and they really rate that experience of getting advice from their colleagues and having a conversation, really, and coming to a joint decision about what to do with the patients. They really rate that experience really highly.
I can see that absolutely. As any interactions that I've had historically, there is almost, you feel disconnected to some degree. Is there any limitation? So Synapsys is looking at, can it look across all potential pathways? Because you mentioned there about the stroke element. So pretty much, as a patient comes in, Synapsys then is going to identify the most effective pathway, regardless of the condition, the complaint, whatever it might be.
Yeah, absolutely. So Synapsys works across kind of the breadth of medicine now. So from dermatology, pediatrics, acute medicine, ENT, respiratory, cardiology, mental health, palliative care. So real the breadth of medicine. So we have more than 100 different specialities using Synapsys. And within those, each specialities, there's often dozens of pathways. So if you look at something like pediatrics, for example, they would have a pathway for rash, lower abdominal pain, failure to thrive, and so on. And what that means for the GP is that they have a single place to get advice. So rather than have to think, okay, well, this is a respiratory problem, how do I contact the trust? Or this is a pediatric problem, what is that bleep number? So rather than that, they have one place integrated into their primary care system where they can just single click and they're talking to the appropriate specialist about whatever the problem is that the patient they're seeing has.
No, fantastic. I suppose, have you seen any challenge around, obviously there's a communication element within clinicians, surgeons, etc., that are going to be adopting the system. Have you seen any challenges around people looking to adopt this, or people wanting to fall back onto traditional ways of working? How have you seen that kind of transition?
So I think the truth is that, clinicians in secondary care are frustrated with the tools that they have, right? They've been making do with bleeps, phones, emails, forever, and everybody knows it's not fit for purpose. It sucks time, and more than that, it contributes to burnout. So what we found is that when we've demonstrated the system to teams in secondary care, they absolutely love it, because one of the things it gives them is control over which patients they see and where they see them. So, without Synapsys, what often happens is that, as I said, the patient will just turn up in A&E, and then the team, ENT or respiratory or cardiology, have to go to A&E to review that patient. Where having that conversation, they can say, don't come to A&E. We've got a dedicated clinic for, let's say an ENT hot clinic where, we deal with ear complaints, or cardiology clinic where we deal with arrhythmias. Come to that clinic. And what that means for the specialist is that they can see the patients that they really specialize in. So, within a department, there will be consultants with different interests, for example, or a specialist nurse with a particular interest. And it means that they can select those patients to the appropriate clinic. And it's just revolutionary for clinicians in secondary care. Really, it's revolutionary in the control that they have, and their ability to make sure that the resources that they have within their department is directed appropriately.
I know you kind of alluded to some stats there, and forgive me if I get these stats wrong, but I think it was something around A&E attendances reduced by 83%, 70% of face-to-face consultations. And then more recently reading a BBC article around the impact around skin cancer patients as well, and the positive impact from a patient perspective. I mean, that must make you feel incredibly proud, maybe share some of your kind of thoughts around, how you perceive the impact that this is having, and against some of those stats there.
Yeah, so, I really love what I do with Synapsys. That's the first thing. It gives me an enormous amount of satisfaction to know that what we're doing and what the Synapsys team is doing every day is making it easier for clinicians to deliver better care for their patients, and that is such a joy to be a part of. And it's the reason that we all work for Synapsys. What we do is as I said, we make it easier for clinicians to deliver better care for their patients, and the result of that really speaks to the work that those clinicians are doing. So, for example, dermatology and teledermatology is a great example where dermatology departments are really overwhelmed now with patients being referred as a suspected cancer. So they're going up exponentially year on year, just the number of patients. And dermatology departments are so busy seeing patients with suspected cancer that they can't see other urgent things like very bad psoriasis or very bad acne. So a lot of patients are waiting too long, frankly, to see a dermatologist because they're overwhelmed with suspected cancer. And we know that when Synapsys is implemented, as it is for dermatology in a number of different areas now, that it reduces the need for a face-to-face appointment by about 70%. So the ability for a GP to simply take photos and send them to the local dermatologist for them to review reduces the need for a face-to-face appointment by about 70% across different areas. And that's testament to, one, the skill of the dermatologist, right, to be able to interpret those images, the GP to be able to share the relevant information. And it's great for patients. Patients really benefit from that collaborative approach between primary and secondary care, which has been lost for a long time, for decades even. And we're just fortunate now that technology is coming in that can make that bond stronger again. So I'm really happy to be part of driving that change.
Yeah, no. I mean, it's incredible. I mean, just hearing some of the outcomes and the demonstrable benefits that clinicians, surgeons, the NHS can derive from this, and the positive impact it has on patients. And I think that from a technology perspective, we're seeing as well. I mean, we're a digital technology partner to the NHS and social care, and we know that the benefits that can be derived from that. But sometimes the challenges around adoption, the communication, the buying. Do you have any thoughts on, because it sounds like an incredible system, and this phrase that you hear so many times is, it's a no-brainer. If it's a no-brainer, then we should implement this, but that doesn't always happen. What's your views on, how do we get into a situation within health and social care where people feel more comfortable? Are we creating the environment for people to be able to foster these different solutions and start to implement them and move away from the kind of legacy, more clunky manual processes? Do you have any views on that?
Yeah, sure. So I think things are definitely moving very quickly in that direction, and I think the NHS has done a great job actually of upskilling clinicians to become, skilled in digital health. So certainly the quality of the conversations that we're having is light is compared to where we were a few years ago. So it's, I think the NHS is doing an awful lot of things right. The truth is, clinicians want change. That they are very dissatisfied with the way things are. They know, in their personal lives, they know how good technology can be. They want the same thing in their working lives as well. So I don't think there's any resistance to change. One of the issues to making change happen is that everyone's busy, right? Clinicians are busy seeing patients, and I think the onus is on companies like Synapsys to make that change as easy as possible. So we really focus on doing the heavy lifting, really, in terms of training, in terms of implementation, in terms of getting our integration right. So we've focused an awful lot on making sure that Synapsys works with the systems that clinicians are already using, like EMIS and System 1 in primary care, and Cerner and other EPR systems in secondary care. So we really focus on that, so that GPs can and clinicians and in secondary care can just use their mobile device if they want to. They can use their desktop if they want to, and they can. Things like single sign-on are important. Just very basic things that people are used to in their personal life when they use technology. We're bringing that into the NHS, and my feeling is that clinicians want change. That's what they expect. They're frustrated that it hasn't happened 10, 20 years ago. But when you show them what's possible, absolutely they're ready to change.
Yeah, no, you touched on something there around interoperability, which is, it kind of gets bandied around, but I think you're absolutely right. It has the biggest impact, these simple integrations, and they sound so obvious that why wouldn't you, bring patient, adverse patient information automatically from a patient record system, single sign on these things, that they do have a huge impact, and something that we're fiercely passionate about as well is around interoperability. In terms of, if you had one challenge or one thing that you could change, what would that be? And I kind of, following on from that, what's next? Where's the journey going for Synapsys and yourself?
So the journey for us is really to keep doing what we're doing. So to deliver the best technology solutions that we can to clinicians in primary and secondary care. As you say, make our system the most interoperable system available, working with NHS systems like ERS, the NHS Spine, primary care systems, and secondary care systems, and doing it in more parts of the country. So we've got very exciting projects about to go live. We're already delivering at scale in a number of areas. So we're very excited about what the next 12 months has in store for Synapsys. We're growing as we have over the last few years. So so we're very excited to really keep doing what we're doing, but doing it for more clinicians and improving all the time. So that's the other thing about it, is we have a culture of continual improvement and learning, listening, and empathy with our users. So we're really focused on that and getting ever better at those things.
I think, I suppose as well, you can see how this almost fits into virtual wards and things like that as we move into ICBs, ICS, integrated care systems. Do you see that that's going to be a part of the evolution as well?
Yeah, absolutely. So the thing about virtual wards is moving patients who would otherwise be in the hospital out into the community. And what you want to avoid is them bouncing back in. So and in order to prevent that, one of the things is upskilling whoever's going to be seeing them in the community, and Synapsys does that. That's our bread and butter. But also making sure that information that's collected in those virtual wards are available, to the clinicians who need to review them. And we're working with a number of different providers now to provide patient level data into synapses, so that decision making within synapses is getting ever more informed and better.
Brilliant. Oh, and I think this is an incredible story and an amazing piece of or an example of where technology can be applied to have a real positive impact, against a heavily pressured and challenged health and social care system. So thanks for sharing that. This is kind of at this point as well where we ask our kind of guests to almost give their what the health tech moment. And this is really where something that stood out, over your career in the NHS, where you've just seen something that you kind of made you stop and think, wow, that is incredible. Might be technology, an event, an outcome, something like that. I don't know if there's something you can share around a standout moment.
It probably sounds like a bit of a cliche now, but I must say, going back to the very early days of COVID, that was such a revelation in the pace at which things got implemented for us as Synapses. So obviously a lot of things were happening, but at that point, so let's say January, February 2020, we had enough data, enough case studies to know that Synapses was the right thing to do. Right, it made sense. It saved money for the system, and improved outcomes for patients, and it was liked by clinicians and made their lives easier. And that was the traditional model then, that you would build a case study and plead your case. When COVID came in March, so it became an imperative. So all of a sudden, it was dangerous to have patients in the hospital unless they needed to be there. And obviously dangerous to the patient. So that change was almost overnight, and the pace at which Synapses was driven out, rolled out to paramedics, for example, and to mental health units in the community, and to community nursing was incredible. And that drive was driven by the clinicians in the hospital and GPs, because they knew the value of it. They'd understood that from the work that they were doing already, and they were saying, Synapses is the solution to keeping patients out of hospital. So that, I know you probably hear it all the time, but it was a real thing that I lived through with Synapses, and that change and the impact that had so quickly, and how quickly clinicians changed things and pivoted and drove change themselves, and how they were empowered to do that, actually. So how, at that time, very people knew what to do, right? So that people became very effective leaders, as far as I could tell, very quickly, and people congregated around them and said, yeah, these people, these are the clinicians with the vision and the idea of how things need to be organized to get us through this crisis. And it was just an incredible period to have witnessed firsthand, really.
Yeah, no, I see that. I think everybody's, come to recognize that COVID and the pandemic was this catalyst for change, but it accelerated that change, and we saw digital adoption increase to some degree. It's almost a shame that we have to wait for these events to become that catalyst, but you can understand why, because of the ongoing pressures. Owain, it's been an absolute pleasure. I'm so glad you shared your story. I think it's a fantastic proposition offering that you guys have, and I hope it continues, and we see it further expanded and hear more about the positive impacts it can have.
Great. Thank you very much, Paul. Pleasure to talking with you today.
Yeah. No, thanks for your time. And thank you, What the Health Tech listeners. You can pick this up on our YouTube channel, Spotify, and on the website. And thank you very much for listening. Owain, again, thank you very much for your time today.